So, did you know that it is said for every 30 pounds an overweight man loses, he will gain 1 inch of visible penile length? And this is something I've heard for years in medicine and really observed it through. I looked it up to try to find the source of this, and there doesn't seem to be any specifics source that I can find for that number, but I've seen it multiple times in my practice. My name is Dr. Saib Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida, and I really specialize in genital work. And regardless of what the surgery is on the penis, one thing to know is a lot of the penile length is buried, and definitely a lot more so in the cases of overweight and obese men. However, there is one particular group we find it disproportionately buried, and there is a surgery that we can do to help them. So in certain groups of men, and we don't fully understand why, there can be a disproportionately large suprapubic fat pad. And what I mean by that is when they gain weight, they may get a disproportionate accumulation of fat in that area. And of course, this can, in essence, bury the penis. Now, in situations even when then the man loses the weight, the condition can still be there because, of course, with weight loss, we can get loose skin, and this can cause a telescoping effect. And the patient, in some cases, it can even exacerbate the buried penis effect. So why would a man have this situation where the suprapubic area is disproportionately big? We don't have a very clear answer. There's been a few theories put out over time. There could be an association with low testosterone, for example, or more likely, it can be an early sign of the metabolic syndrome. Now, what I mean by the metabolic syndrome is when your body begins to not be able to process sugar like usual, and it's a very early sign of type 2 diabetes. And so we know in those situations, fat, like visceral fat, can become very stubborn and hard to get rid of and gets involved in this sugar cycle, and we have to increase our insulin levels, and the insulin stops this fat from being burned. There also have been a few genes specifically that have been identified that can affect fat distribution, because for sure I see men, most of them granted are overweight, but they have a disproportionately large pubic area, which causes a lot of problems. And in these men, it's not necessarily just a cosmetic issue, but it can be a functional issue, even to the point that the penis is buried, it's difficult to urinate, never mind sexual function. So the surgeries for this condition, in my experience, can be an absolute game changer, and it's really one of my favorite things to do in practice. I see both men who are obese and aren't necessarily going to lose weight, but we target that area. And very commonly, I see men who've already lost weight, but still have that bothersome skin there, and oftentimes a lot of that resistant fat as well can linger on despite them getting down to close enough to a quote-unquote normal body weight. So pubic lift surgery usually involves liposuction as well, because most men will still have a significant fat pad down there. So typically we'll start out by doing the liposuction, and then we lift the excess pubic skin in order to decrease the extra tissue there and unbury the penis. And in this way, we can oftentimes get more than even 1 inch of visible penis when we do this procedure. It can be combined as well with a tummy tuck if needed. But in many men, we're just focusing on the pubic area, and the scar will be hidden in the belt line.